pray. So hi to anybody that is listening. So we are going to do a kind of recording of a workshop which should hopefully help you to think of some techniques to help you cope with COVID at the moment. So just to intro and just to explain a bit about what today's like. So I'm Charlotte Hodges. I'm a psychological wellbeing practitioner for Talking Change, and this is my lovely colleague. Do you want to introduce yourself, Becky?
Hi, I'm Becky. I'm also a psychological wellbeing practitioner at Talking Change. Been in the service for about 3.5 years now.
Great, yeah. Just you guys the heads up as well, we are following social distancing guidelines. We're both working from home. So if we do at any point get interrupted by pets or other people that are in our kind of household, then do bear with us. We'll just keep going. So just try and ignore any distractions that do happen. We're doing our best with what we've got at the moment. So we're from Talking Change, and we're going to take you through a series of slides today to hopefully introduce some techniques that will help you cope with COVID. So if we go on to the next slide, Becky. So just to explain a bit about who we are, so we're a group of kind of mental health professionals, and we have a lot of different kind of people that work for us at Talking Change. So psychological wellbeing practitioners like ourselves. We also have psychotherapists, counsellors, and what we do is we specialise in understanding and treating common mental health conditions. So that's things like depression, anxiety, panic. There's lots of different conditions that we kind of treat using CBT. Well, myself and Becky using CBT principles. And we offer short-term psychological support and other types of therapy as well as CBT. And we treat lots of different people that come into our services with these kind of conditions, also people that experience kind of long-term physical health difficulties as well, young people, older adults, so lots of different people that access our service. And all of the treatment that we offer is based on appropriate care that's based from the National Institute of Health and Care Excellence. So any treatment that we do offer our patients is always the treatment that has been researched and that has a lot of kind of research and guidance behind it. So that's what we do as a service. So in terms of what we're doing today, so this isn't a normal session in that me and Becky are kind of doing this pre-record to send out to you all. But we're aiming to give you some tips and techniques will be helpful at this time. So we're all living in a really kind of strange and weird time at the moment due to COVID-19. And we just wanted to reach out to people to give some advice basically on how to kind of cope with all the changes that are going on at the moment. If you feel following this that actually you realise I am really struggling at the moment and I could do with some support with my mental health, then you can refer to us, and we've got a bit at the end that will explain how you do that. So just if you do listen to this session and you do feel as though you need some extra support, then we'll explain how you can get in contact with us and refer yourself to the service if you live in the Portsmouth area. Just as a side note, because this is pre-recorded session, obviously we're not offering any individual support or any risk management of any kind, and Talking Change as a service isn't an emergency service. So if you do feel that you need urgent help with your mental health, then please do speak to your GP, your manager if you kind of work within a healthcare setting, or you can call 111 for kind of urgent advice if you feel that you need that. So just as a heads up of the kind of extent to the support we can offer today.
Okay, so jumping into some of the materials for today, as Charlotte said, everything at the moment is a very strange time. You know, this is a very unprecedented situation that we're all living in at the moment, and it's understandable that a lot of people are struggling with, you know, this this very question, how should I be feeling? So different people react to different situations, and the most important thing we want you guys to take away from this session is that there is no right way to feel. There's no handbook, there's no guide that's been written on how we're supposed to manage a international worldwide pandemic. There isn't a right or wrong way to feel. But what can be really helpful is actually starting to identify how you are feeling and actually labeling it. So what can be really helpful is just asking yourself some really simple questions. So we've just got them on the screen here. So just what challenges are you facing in the current situation? Thinking about things that have changed in your life, thinking about any new roles that you might have taken on. They're all new challenges, they're all new things for us to face. How are we feeling? Identifying those emotions, labeling those emotions. If that's something you struggle with, we would really encourage you using emotion wheels. There are loads that you can find online that can really help you label how you're feeling. Identifying kind of what thoughts or worries are going through your mind, writing it down, giving yourself a bit of distance from it, really trying to identify and engage with the cognitions, all those thoughts going through your head. What are we noticing in our bodies? Our bodies react very much alongside our emotions. So actually acknowledging what's going on. Sometimes you might just notice physically you're just not feeling quite right. So again, put a word to that, put a label to that. And is there anything that you've been doing differently recently, or anything that you've been avoiding, for example? Have you noticed any changes to your behaviours and how you would usually react or respond in a situation? How have you noticed that you've wanted to react or respond in a situation, but something stopped you? Again, these are all really helpful things just to identify, which can help us understand, how we are feeling at the moment. Anything you'd add to that, Charlotte?
No, nothing to add to that.
So then once you've kind of understood and started to label how we're feeling, one of the most important things is to accept how we are feeling. It's very, very likely, we're all experiencing some unpleasant emotions at this time. But it's also understandable if you experience some, not unpleasant emotions, some more pleasant emotions. But what's really important is that we need to accept how we're feeling. So we've all been forced into this really strange situation, this really strange environment, and we've just had to accept that this is the situation at the moment. We've just had to accept, we're in lockdown and there's nothing we can do about it. So it's really important that we apply that same principle to how we're feeling and just accept that actually this is how I'm feeling right now, even if those emotions are quite difficult. Because what we do know is that if we fight against how we're feeling, that can then lead to more difficult feelings. And if we're fighting against those negative emotions, it causes us a lot of distress. Whereas if we can just accept how we're feeling and almost make some kind of peace with that, it is a lot less distressing for us. Anything you'd add to that, Charlotte?
Yeah, just exactly that. I think the minute we try and kind of suppress those feelings or put pressure on ourselves to feel a certain way, we're just adding into that pressure we've already got on us at the moment. It's a really difficult, pressured situation, so we just want to be kind to ourselves. And rather than fight against the way that we're feeling and pretend that we're okay, or think that, this person's coping better than me, or I've heard so many people say, I haven't got it as bad as such and such, so I shouldn't be feeling this way. Whereas actually, it's perfectly normal to be struggling at the moment, and it's perfectly normal to have days where things feel really difficult and to have days where things don't feel really difficult. So just be as kind to yourself as you would to anyone else around you that's struggling at the moment, I think.
Yeah, absolutely. And as I said just now, there is no guidebook on how we are supposed to feel at the moment. So you're managing the best that you can. You're feeling the way that you should in this moment, and that's absolutely okay. So as Charlotte said, it is just about being quite compassionate to yourself, and we will look at that a little bit later on in the session today.
So this slide is just kind of highlighting that there's lots of common things that we may all be experiencing at the moment. So just following on from what Becky was saying, in that there's probably lots of different emotions that we're feeling day to day, week to week, and as this kind of situation goes on for us. So some of us might be feeling kind of bored or lonely if we're isolating or away from our loved ones. There might be feelings of loss, and that can be for, you know, lots of different things. So it might be loss of a role as well as loss of, you know, loved ones. And these can manifest in lots of different ways. So as Becky mentioned, physically, we may be feeling different at the moment, and we may feel different day to day. There's lots of behaviours that might have changed for us in terms of what we're doing differently to respond to the situation, and lots of different thoughts that may be kind of happening for us at the moment. And again, I suppose it's to highlight that this is just a snapshot of what you might be feeling. There's probably lots of different things going on for different people at the moment. And also there might be days that you're feeling okay, and things are feeling, you know, there might be a bit of relief that you don't have to go to work that day, or a bit of a relief that you aren't getting pressured to go out socially that day, for example. And that's also okay. It's very normal to be feeling up and down and to have these different emotions. And it can be, you know, if things are really difficult for you at the moment. I know myself, some days there's that guilt, actually I should be feeling a certain way at the moment with everything that's going on. But if you're not, and you're actually feeling okay that day, that's fine as well. It's just about going with and accepting how you're feeling in that moment, and taking it day by day as well, because, you know, there's a lot of uncertainty at the moment. So these emotions will change as the situation changes, and that's okay. Yeah, there's going to be a lot of that's okay during this session, but I just think it's a really important message to try and kind of that acceptance around that. Yeah. Anything? No. So this cycle is called the vicious cycle, and it's commonly used within CBT to kind of provide a kind of snapshot of the way that you're feeling at the moment, and also the way that things interlink. So what we often say is that we've got different areas that we can break our experience down into. So we've got the situation that can trigger that off. So broadly, if we're speaking about COVID today, we could put COVID up there, but obviously it's what's going on for you amongst COVID is going to be very different for everybody. So some people might be having to work from home. Some people that are working frontline, it might be going into work, losing people, not being able to speak to people. So you can adapt that to what's going on for you at the moment. And then that can trigger certain thoughts for us. So a thought kind of being, so within CBT, it's Cognitive Behavioural Therapy. So cognitive is just a fancy word for thought. So the kind of thoughts that are running through our mind, whether they be negative, positive, neutral thoughts. So whatever it is, we often call it the sentences that are running through our mind. And those thoughts that we have can affect how we feel physically and also emotionally as well. So if we have, for example, lots of what if thoughts, which we can often have with anxiety, and we'll kind of go on to, so what if, I'm just thinking generally now, what if my sister gets ill, or what if I'm no longer able to go to work? So lots of different what ifs that can come from the uncertainty at the moment. And if you think about all those different thoughts that you're having, how that's going to ramp up your emotions. So if you're having all those what if thoughts, you might be feeling increasingly anxious. And then you can see the arrow goes in both directions. If you're feeling increasingly anxious, that's probably going to ramp up those what if thoughts. If you're having more of those what if thoughts physically, that might affect you. So there's lots of different physical symptoms you can experience with that goes along with anxiety, and we'll talk about that more in the session today. It's also going to affect your behaviour. So it may be that for example, you try and put lots of different plans in place for if different things happen. And then the more that you do that, the more anxious you feel, the more of those thoughts you have. So you can see it creates a kind of cycle effect. Also, as well as anxiety, it may be low mood that can be triggered for you. So if you're having lots of negative thoughts about yourself or the situation, that might be making you feel more low in mood, and that might affect your physical sensations or your behaviours as well. So lots of different emotions going on for us, triggered by this current situation, that can fuel this cycle in different ways. And what it can be helpful to do, if you're struggling to accept the way that you're feeling, or even know the way that you're feeling at the moment, it can all feel very uncertain, then getting this down for yourself can be a really helpful place to start, because it can just help to get all of those feelings and thoughts out onto a piece of paper. And this is what we'll often do with our we'll always do it with our patients, especially as PWPs if we're working with them. The vicious cycle is where we start. So this is something that you can do for yourself. Just get it all down onto paper and see how it all feeds into one another. And what that helps to do is to create some awareness of how you're feeling at the moment. And it can also help you to spot some changes that you can make, which we will go into in the session. But it's just a really nice place to start. Is there anything you'd add to that, Becky?
Pretty much just exactly what Charlotte just said. The reason that the vicious cycle is a really helpful tool to use is because it just helps organize everything. Because when we're feeling, stressed, worried, anxious, low, things they don't tend to be sort of nicely organized into this is a thought, this is an emotion, this is how I'm feeling physically, this is what I'm doing or not doing. So it's just a nice way to give it a little bit of structure. So it is a really, really helpful tool. And I think the other thing I would add is when we're looking at our thoughts, it doesn't have to be words. We very rarely think in words. So it might actually be what images are going through your mind, what pictures are going through your mind when you notice you're feeling anxious, for example. All of that information is helpful because, as Charlotte said, we can then use it to think about how we can break down this vicious cycle so it can't keep going.
Yeah.
Okay. So we're going to start by looking at the behaviours box because we tend to focus on our behaviours initially in CBT because they're the ones that we have quickest access to. So we can see our behaviours. It's very easy to observe what we're doing. It's much harder when we're looking at our thoughts typically. So looking at our behaviours, you might have noticed that you've noticed some changes in how you're behaving because we're not able to do what we would typically do sort of in our day-to-day life. So one thing that we wanted to introduce you to is the idea of what we call the lethargy spiral. And the idea of the lethargy spiral is the less we do, the worse we feel. So I'm sure we've all had a day where we haven't really done anything. For me, it's usually a Sunday where it suddenly gets to about 4 or 5 o'clock in the afternoon and you're absolutely exhausted. And you say, why am I so tired? I haven't done anything today. That is the lethargy spiral in action. The less we do, the worse we feel. And the less we do, the harder it is to get that motivation or get that oomph back. So what we want to do is identify when we might be falling into the lethargy spiral, especially at the moment because there isn't very much that we can do outside of our homes. And especially if you're no longer working like you would usually, your routine's probably gone out of the window a little bit. So you're very susceptible to this. So there are some ways that we can help reverse the lethargy spiral and get ourselves out of it. Anything you'd add to that, Charlotte? No, got a mic muted. So basically what we want to do to try and get ourselves out of the lethargy spiral is reverse it. So what we typically do when we're feeling low is we notice an increase in feeling unmotivated. I'll do it later. I'll do it when I feel a bit better. I'll do it tomorrow. What we tend to know is that tomorrow never comes, and we're then very likely to put something off even further, which then just feeds more into us feeling even worse about ourselves. So there's a very good phrase to remember, which is motivation follows action. We can sit around all day waiting for motivation to come and hit us. Unfortunately, it's not coming until we take that sometimes really difficult first step. And once we start doing something, motivation follows. So what we typically find is that once we start an action, we're then much more motivated to carry on with it. Motivation, as it says there, doesn't appear out of thin air. So we do have to take those first steps, which can be really difficult. And we will look at sort of, I think, on either the next slide or the slide after that, of how we can sort of help ourselves take those first steps. Anything you'd add to that, Charlotte?
No, yeah, that motivation following action being, the key point. So often we can want to wait till we feel better on the inside before we do anything, but that can be what leads us to really going down into that lethargy spiral. So sometimes it's about acknowledging the way that you're feeling in that moment, but trying to change something that you're doing to help that feeling change, which can feel really difficult to do, but we'll follow up with some ways to do that. Yeah, but I think that's a really key part of not sinking down into that lethargy spiral.
Yeah, absolutely. And I think another important message is the lethargy spiral will take hold really, really quickly.
Yeah.
So it's just about recognizing it, and the earlier we recognize it, the earlier it is, and the easier it is for us to step in and make a change.
And we'll talk about as well, it doesn't have to be that you're necessarily doing anything big to step out of that, because if you're feeling unwell, for example, and you're not up to going on a run or anything like that, sometimes it can just be the smallest actions that can bring us out of that spiral, the smallest kind of activities. So that's kind of what this slide is all about. So it's talking about taking action, and the first step to doing that can be identifying kind of pleasurable or routine activities that we can do if we notice we're falling into that kind of lethargy spiral. So often when we're feeling low, we can tend to stop doing the pleasurable activities. That's the one that usually drops off first. Because it may be that the routine activities that we do day to day, like cooking, washing, working, whatever it may be, that gives you that routine and structure, that's something that we need in our routine to function day to day. So for example, if you don't turn up to work or doing work online, then there's going to be a consequence to that. Whereas with these pleasurable activities, they're easier to drop off because there's less kind of repercussions in terms of kind of physically somebody telling you need to do that. But actually, if we don't have those pleasurable activities in our day-to-day, we can really notice a drop in our mood. So it's important that we have a balance of all of these things. And obviously in the current climate, it has changed. What we do for pleasure is restricted for some of us. So if we're used to going out and meeting people socially, and that's what we find pleasurable, or outside activities that we can no longer do, is trying to be creative with that and trying to think a bit outside of the box in terms of what we can do, and when needed, kind of scheduling that in so that we stick to it. So for example, I know that with my work diary, that's very scheduled, and that helps me keep to that routine. And over the last few weeks, actually scheduling in calls with friends or Zoom calls with friends or catch-ups, whatever it is that it may be, just to make sure that that's still happening, because it's going to have a real impact on your mood if we haven't got that balance. So, and it may be kind of things that you're doing on your own, so scheduling some time for reading or drawing or whatever it is that you can still do within the current climate, and just making sure that's in your day somewhere to help with the way that you're feeling. And also a bit of a routine can be helpful to set in place for if you are used to going to the office or going to work. I know that many people have said it's still helpful to get out of a bed at a set time, change into clothes that would be kind of work clothes, or have set meal times. Whatever works for you, but just trying to make sure you're sticking to a routine as much as possible if you feel yourself going into that lethargy spiral, but a routine that also includes those pleasurable activities as well. Does that make sense, Becky?
Yeah, it does. And exactly as Charlotte said, it's just getting that variety of actions, so we're not just doing the things that we have to. And this is a really good opportunity for us to be really quite creative with identifying new pleasurable activities that you might not have had time to try before. So it's a really good opportunity. There are loads of things online that you can help you sort of lists of kind of pleasurable activities that you can just try something, because I guess until we try it, we don't know that it's not going to be something that we enjoy. So it's just finding what works for you.
Yeah, and I think as well at the moment there's a lot of pressure on social media and online to be productive with your time. And there's lots of stuff going around about what you should be doing, and especially with people that have got kids at home and homeschooling, and and it's, I suppose, trying to take some of that pressure away. I know it's easier said than done, but if you're spending an hour, for example, just doodling, and that's not necessarily something that's really productive, but if that gives you a sense of calm or a sense of pleasure, then that's productive for your well-being. And that's just as important as something that you can share with other people, or you can put online or on social media. We don't need to be putting this extra pressure on ourselves at the moment. So actually just getting through the day and having that sense of calm or having that sense of pleasure, enjoyment is enough. So I think trying to relieve some of that pressure we're putting on ourselves could be helpful as well.
Yeah, it's definitely just finding what works for you.
Yeah.
Which is why we're not going to be telling anyone in these sessions to do this really specific thing,
No.
because that's just not helpful. There's an old saying that you wouldn't put false teeth through the letterbox and hope they fit the person inside. We're not just going to be throwing techniques and saying this exact thing will work for you, because you're your own person.
Yeah.
And as Charlotte said, it's just finding what works for you. And if that is sitting down and doodling for an hour, if that works for you, if that takes away some of the distress that you might be feeling at the moment, do it. That works for you.
Yeah, definitely. So this side is just coming on from that other side. So it's about prioritizing when choosing your activities and what you want to schedule into your day, about prioritize what's important to you. You can't do everything at the moment, and you may be taking on more roles than you're kind of used to. So an example of that I can think about is homeschooling, for example. If you've got children at home that would normally be at school, okay is good enough. If you don't have to have a full day of you're not a teacher, you haven't been trained to be a teacher, and doing the best you can in the current climate is perfectly okay. So again, it's going along with that kind of pressure. And if you feel that the to-do list is mounting up, it's okay to prioritize and just do what you can. You don't have an infinite amount of hours during the day, so just getting what you need to get done is always advised, really. It may be that you've got extra people within the house, there's extra housework to do. If you're working frontline, there's extra hours to do. The possibilities are endless in terms of what you might have on at the moment. So it's just about prioritizing, and that key message of accepting that okay is good enough is really important at the moment, I think.
Yeah, absolutely. At the end of the day, we're all just doing the best that we can. Even myself and Charlotte, in an ideal world, we would have loved to deliver this, in a face-to-face room of people, but it's not happening. This isn't ideal. We're doing the best that we can, as is everyone at the moment, and that's all that can be expected.
Yeah, definitely.
So just to help with that idea of prioritising, this is a really helpful little grid that we typically advise people to use. It's much, much better than using your traditional to-do list that can feel really quite overwhelming, because I don't know about anyone else, but whenever I write a to-do list, it seems to get so much longer before I tick off anything. So for every one thing that I tick off that I've completed, I have 5 more things to add on, which is just stressful. So this little grid here just helps us organise what needs to take our attention. So we define things by their importance and their urgency. So important is how much it means to us. What does it mean to us? Is it important to me that I do this? And the urgency is typically things that have a time frame on it, so actually doesn't need to be done by a certain amount of time. So things that build up in our important and urgent books can feel really overwhelming, because these are things that we're like, I have to get this done and I have to get it done now. If everything in our life is sitting in that box, it's going to feel really overwhelming. It's going to feel very, very stressful. And we're then very likely to not be able to do everything because we don't know where to start. So if we can shift some things to the other boxes, it's just going to help level things out and allow us to focus on the things that need to be done when they need to be done in a much more productive way. So the important and urgent books are those things that are really, really important that we do. It means a lot that I do it and it has to be done now. Our important and not urgent books are the things that actually might be important for me to do. I really might care about it, but it doesn't need to be done right this second. There's no time frame on it. I'll come to it when I have the time. Our not important and urgent books, these are the ones that maybe aren't so fun, and typically these are demands that come from other people. So actually it might be an assignment that you've been given for work, for example, and actually I don't really care about it. It's not that important to me, but it is urgent that I do this. It does have that time frame on it, so it does need to be done. And then we have our not important and not urgent books. And these are the things that kind of never, we'll get to them when we get to them, because they're not that important, they're not that urgent, but they are things that still give us maybe that sense of satisfaction if we do tick it off. So for example, it might be, for me it's ironing actually. I don't really care whether I don't iron my clothes, and it's not actually that urgent, it doesn't need to be done. But when it is something I do eventually get around to, it does give me that sense of satisfaction. But actually I'm not going to put ironing into my important and urgent box, because that's just going to cause me so much extra stress for an activity that I don't actually particularly enjoy, and it doesn't actually make that much difference to my life. So if we can move things around these 4 boxes a little bit, it'll just take some of that pressure off. And what we want to try and do is have the focus on the important, not urgent box. So we're still getting things done because they mean something to us and they're important, but we haven't got that time frame of actually it has to be done right now. The only thing that should ever, ever, ever be in important and urgent is you. And that's because if we're not prioritizing ourselves, if we're not looking after ourselves, there is no way we can be expected to manage everything else that we have to do at the moment. If we don't look after ourselves, we can't look after everyone else. If we don't look after ourselves, we can't expect it to keep up with all of the additional demands that we have. There's an old saying that you can't pour from an empty cup, and it's so true. You need time to recharge yourself. So you are the only thing that should ever be in that important and urgent box as the ultimate priority. Anything you'd add to that, Charlotte? No? Okay. So another really helpful tool that you can use alongside the prioritising is the use of SMART goals. So if you work in any sort of business environment or sort of healthcare education, you might be familiar with the acronym of SMART goals. But SMART goals are just a really, really helpful way of breaking things down into actions that actually are going to be manageable for us. So SMART stands for specific, measurable, achievable, realistic, and timely. So an example of this I always use in my sessions is going for a run. I'm not a runner, which is just a really quick disclaimer. So if I say I'm going to go for a run, it's probably not going to happen, because I'll come up with an excuse today. I'm like, oh, it's a bit windy outside, I'll go tomorrow. Then tomorrow might come around and it might be raining, so I'm like, it's not going to happen. I'll do it on the weekend. Knowing me, it's just not going to happen. Whereas equally, if I say on Saturday I'm going to run a marathon, I've been a bit more specific of when I'm going to do it, but actually when we look at the achievable box there, definitely not achievable. I cannot run a marathon. It's not going to happen. I'm going to be setting myself up for failure. So the way I might make my goal to go for a run smarter is by making it really specific, measurable, achievable, realistic, and time bound. So an example of my SMART goal might be on Saturday at 10 o'clock, I'm going to go for a 10-minute jog around the block. So that is much smarter. So I'm being really specific with what it is I want to do. It's measurable because I know that when I've done it, because I've set myself a time limit of I want to do 10 minutes. I know for me that's achievable. I can definitely do that. It's realistic. It's something that realistically I can do. And it's also relevant if my longer term goal is to be able to run a marathon. It's going to help me build up towards doing that. And I've also been really timely with it. So I've said, okay, on this day, at this time, this is what I'm going to do for this length of time. I'm much more likely to achieve that goal than if I say I'm going to go for a run. It's just not going to happen. So SMART is a really good thing that you can apply to any goals that you do. The smarter you can make your goals, the more likely it is you're going to be able to achieve them. And what we typically say as well is try and aim for something that you know is absolutely achievable. Okay, because then if you do more on top of that, you've just exceeded your goal. So for example, it might be that actually I know that I can run for 20 minutes, but I'm going to set my goal for 10 minutes because then I know that I can absolutely do that. And if after that 10 minutes, that's all I want to do, I've still achieved my goal. But I might find that actually I want to go on for a little bit longer than that. And if I do, I've just exceeded my goal. Okay, does that make sense? Any questions or kind of comments, Charlotte? Do you think you'd add?
Yeah, I'd just say it can be really good to use for if you notice those pleasurable activities are tailing off as well. So often when we think of SMART goals, we think about, stuff we need to do. But if we're trying to make sure that we're including those pleasurable activities in your day-to-day, a SMART goal around that can be really useful, and trying to stick with the same commitment that you would if it was something that you felt you needed to do, because we do need those pleasurable activities in our day for our well-being. So it can be nice to set a SMART goal around them.
Yeah, absolutely. Okay.
So this is just summing up some key tips to remember when we're thinking about trying to break out of this spiral. 5-minute rule is a great one. So we talked about action before motivation, and that can feel really difficult to do. So if we're feeling really low or just really fed up, and those thoughts of I can't be bothered are coming into our minds, we know that something might help us to break out of that cycle, but the motivation just isn't there to do it, which is really understandable, because lack of motivation is one of those key symptoms of low mood. The 5-minute rule can be really helpful. So I often say that the 5-minute rule is almost like a bargaining chip with our head. So we're just saying to ourselves, okay, I know I really don't feel like doing this, but I'm just going to give it a go for 5 minutes. So if we go back to Becky's example of a run, we get to that run 10 o'clock Saturday morning, and we've all been there. I just really don't want to do it. I'm really not feeling it, but I know it's probably going to help me. It's going to help me break out of that cycle. Just put my running shoes on, put my clothes on. I'll just go for 5 minutes. So you're just bargaining with yourself there. Often what we find is that once we're 5 minutes in, we can say, okay, that's not so bad. I'll go for another 5 minutes. And then we've done our run. Or you can keep going in that same vein if you are going for longer. But often once we're 5 minutes into an activity, it's given us that little bit of motivation to keep going. And then as you get through the activity, that motivation builds. If it doesn't, you've done 5 minutes more than you said you would, and you can come back to it and try again, the next day or whenever you've scheduled that in. So it's just a really helpful technique just to give you that little bit of motivation to get started. So that can be a really helpful one to use. Talks about pacing yourself, which we'd always encourage for many different reasons. If you feel that you're really not doing much at the moment, you feel that you're stuck in that lethargy spiral, and then you set yourself a full week of activities to do, really kind of structured, lots in your week, you're probably setting yourself up for failure there. And that's just because you're going from 0 to 100, and that's going to feel really difficult. So what we want to do when we're setting out these plans is be kind to ourselves. So challenging ourselves, but being kind to ourselves and taking it step by step. So gradually, so you might schedule in less for the first week, then a bit more for the second week, or it may be day by day, whichever feels kind of better for you at the moment. So pacing yourself, and that can also be, you know, if you experience any long-term conditions or anything else that's getting in the way of you doing what you want to do, not overexerting yourself, challenging yourself, but in a way that again is kind to yourself, and that feels pace and feels achievable. On the back of that, breaking it down into small chunks. So, you know, whatever the activity may be, is there a way that you can break it down so that it is more gradual? Making sure you're taking plenty of breaks. So for example, if you've got a big essay to write, scheduling in 5 solid hours to write that essay, probably, well, I know for me that just wouldn't happen, but depending on how long you've got to do it, maybe scheduling in half an hour a day or a certain allotted time each week, it feels more achievable. And the little chunks of time, each little bit that you do, again, builds that motivation. So again, being kind to yourself. There's only so much time in the day, definitely. Again, going back to that pressure that a lot of us are putting on ourselves at the moment of all the different things we should be getting done and using this time productively, is not necessarily helpful. You have only got so much time. You're not superhuman. And it's just about recognizing that, and also recognizing that, you know, it's good enough just to get through the day at the moment and just to be doing what you can. So giving yourself a break. And often we say there kind of, what would you say to a friend? And just being as kind to yourself as you would to other people. And self-care is not selfish. A really important point, and just going back to the point Becky was making, we can't look after other people unless we're looking after ourselves. And we may be under a lot of pressure at the moment to look after others, and that can be physically, emotionally, lots of different ways, whether it's in work, out of work, at home, family, friends, you know, personal networks, whatever it is. Looking after yourself has to be a priority. And I know a lot of people find this difficult, especially if they've got kind of lots of care and responsibilities, but you just can't look after other people if you're not looking after yourself, because you just won't have the energy to do so, and you won't be your best self either to support other people. So finding ways to look after yourself is not selfish. And it's really about reminding yourself of that. And if you're someone that struggles with that, just reminding yourself, actually, this half an hour that I've set aside for myself is going to enable me to give more of myself to others, because I'm going to have that energy within me. And even if it is just half an hour of, you know, doodling, for example, that helps give you that sense of calm, that's not selfish, because that'll enable you to be, you know, use more energy for other people. So it's really not selfish. That's a big point that I would emphasize. Yeah. Anything you'd add to that, Becky?
No, I think Charlotte just hit it on the head there. Just again, it comes back to that message we keep saying: do the best that you can do. So as Charlotte said, no one is superhuman. You're not expected to, you know, achieve incredible things each day. We're just doing the best that we can. And as she said, rightly so, you are the most important person. So make sure you are looking after yourself in whatever way that needs to take at the moment. It's okay. There is no right or wrong way. So just moving on to looking a little bit about anxiety. We will talk a little bit about the anxiety response today without trying to go too technical into it. But anxiety is completely normal. It's a very, very fundamental part of being human. But understandably, a lot of people are experiencing a lot of additional worry or anxiety at the moment, because as we've already said, we're in a very unprecedented time, that we're facing new challenges each day. There's a whole ton of uncertainty and unsureness around everything at the moment. That's going to make us feel quite uneasy. So there's just a few points here about things that could be causing us anxiety. So, worry about loved ones getting ill, changes to work or job loss, finances at the moment, massive stress. Struggling with being in self-isolation, differences in family, friend relationships, all these new roles that we might be taking on. This is absolutely not an extensive or exhaustive list. It's just an example of some of the things that might be causing us anxiety at the moment. And these are things that we are all struggling with at the moment, so it's very understandable that they are causing us some distress. So just looking at kind of the anxiety response, I won't go into this. I can talk about anxiety until the cows come home, so I'm not going to go into it in too much detail, but you can find a lot of really helpful information on the NHS websites if you want to. But basically, our fight or flight response is our anxiety response. So we have the little people there with our fight, flight and freeze little people down at the bottom. If people have ever heard of our fight or flight response, it's one of the oldest, most primitive parts of being human, and it's the reason that we're still alive. And our fight or flight response is our anxiety response. So when we are faced with times of perceived threat, our body goes into this very primitive state where we're either going to fight something, flight, so run away from it, or we might freeze. And this comes from when we were cave people. So when humans first started evolving, there was a very real chance of us being eaten by a saber-toothed tiger, for example. Obviously, as humans, our natural instinct is self-preservation. We don't want to be eaten by a saber-toothed tiger. So what happened is there's a little part at the back of our brain that started developing called the amygdala. This is our threat system. It's our danger brain. So what our amygdala does is it scans all of our sensory information and it picks up on things that could potentially cause you some sort of harm. So when we were cave people sitting around the fire, our amygdala might clock on something in the distance and it thought, that could potentially be a saber-toothed tiger. That's going to eat me. That's not good. I need to keep you safe. So some various things happen in our body, and the hormone adrenaline is released. And it's this adrenaline that gives us the energy and the ability that we need to either fight that saber-toothed tiger, run away from it, or freeze and essentially play dead. Okay, lots of animals do that in the animal kingdom. So we might notice that this is happening more and more so at the moment, given the situation going on, because our amygdala is a very primitive part of our brain. It's very, very old. It doesn't understand that something isn't going to eat us. Any sort of worrying thought, anything that it perceives could be harmful, i.e. uncertainty or being unsure, it's going to interpret that that's a saber-toothed tiger that's going to cause you some harm. So it aids that release of the adrenaline to get us ready to fight something or run away from it. So thinking about how that might be impacting us at the moment, we might notice that actually we're becoming a little bit more snappy with people. It might be because we're feeling quite anxious and we're in that fight mode. We might be putting sort of our spikes out just to keep people at arm's length because actually we're feeling quite fragile or quite vulnerable. We might be noticing that we're wanting to just run away from things and hide from things or avoid thinking about things more and more so. Really common one at the moment is just avoiding talking about COVID, avoiding looking at the news for all the daily updates. It might be a way of sort of running away from it. Or, if we're struggling with being in a house full of all of our family where we wouldn't usually spend so much time together, you might notice that desire to sort of want to retreat a little bit, sort of hide away a little bit. That's our flight response, completely normal. Or we might notice that freeze response, where this is almost like that rabbit caught in the headlights feeling, where I just don't know what to do. And actually, I cannot move forward with this because I feel really, really, really stuck. Again, really, really common feature when we're feeling anxious. None of these responses are bad or wrong. They're your body doing what it's supposed to do in times of threat. your body is trying to keep you safe from something it is interpreted as a threat, or as essentially as a saber-toothed tiger that's going to eat you. And you don't have any choice in how your body reacts in times of threat or in times of stress. Your body is either going to go into fight, flight, or freeze, and you don't have any conscious decision over that. We don't consciously choose to do this. It's your body going into survival mode. It's your body working on instinct and doing what it needs to do to survive. So there's, as I said, there's no right or wrong way we're meant to react in this. It is just doing what our bodies need to do. So what we're going to look at today is just ways of calming that threat system down a little bit, so we're not always living in this sort of state of threat. Anything you would add to that, Charlotte? I know that was quite wordy.
No, nothing I'd add. That's perfect.
Okay. I'll let you talk about the anxious body.
So we won't go into this too much, but this slide is just to show that there's lots of physical symptoms that can come from that fight or flight response being activated. And I suppose what we want to do is kind of reassure you, as Becky said, that these are all really normal, and there's physical explanations for a lot of these things that are happening. Because, for example, your heart beating faster, that's your heart pumping more blood around the body in order to prepare you to fight or run away, if you were presented with that physical threat. So all of these symptoms that you can see on this diagram, they're all perfectly normal, and there's those physiological explanations for them. And the reason we like to talk about these is we can often worry about what these symptoms then may be. And if we think back to that vicious cycle, if we're having that physical symptom and then we're worrying about what that physical symptom is, again, that's going to ramp up that anxiety, which is going to feed back into that physical symptom, and you can see that kind of spiral that would form. So actually just acknowledging that this is our fight or flight system, and then using some of the techniques we're going to introduce today to try and calm that down, can be a way of breaking out of that cycle rather than fueling it. So it can be helpful just to have a read over these. And there's lots of information online on NHS as well about the fight or flight response and the physical symptoms of anxiety that this can prompt. Yeah. Next one. Okay, so this is the worry tree. This is one of my favourite CBT kind of techniques, because it's really it's really simple, but it's really helpful to help manage anxiety, and especially the anxiety that may be going around at the moment. As I kind of mentioned as I mentioned a few slides ago, a lot of what if worries about at the moment. So it's a really uncertain time. It's probably one of the most uncertain times we could be faced with at the moment, a kind of global pandemic, and not knowing what's going to happen from each day. And what we know about anxiety is that uncertainty can trigger a lot of these what if worries. So what if this is going to happen? What if that's going to happen? What if this person gets ill? Etc, etc. So lots of different worries that can be prompted. The worry tree helps us to categorize our worries, and the reason that this is helpful is what we tend to do is treat all of our worries in the same way, especially when we're feeling anxious. So as humans, we're natural problem solvers, and we want to be able to solve all of these worries so that we have some element of control over them, and so that we feel more in control. But when we try to solve a worry that isn't solvable, that can actually serve to fuel that anxiety cycle further, because all it means is we're thinking more about it, and we think more and more about it because we're trying to solve something that actually can't be solved, because often it's future based, and that's what we call a kind of hypothetical worry, and that's what a what if worry essentially is. So when you find yourself sitting with lots of these different worries and thoughts going around in your head, a really key question that can be useful to help categorize that worry is can I do something about it right now? So is there anything that I can do about this worry right now? If the answer is no, then it's very likely that that worry is a hypothetical worry. And a hypothetical worry is often a worry about the future. And because it's about the future, there's nothing that we can do to solve that worry in that present moment. So, for example, what if my elderly neighbour gets unwell? That is future based, and because it's got that what if element, we can't do anything about it because they're not currently unwell at the moment. If it got to the point where they were unwell, so that worry would change. So my elderly neighbour is unwell and needs help, and that's when we could do something about it. So that's when it would be a practical worry, and we'd think about all the different things that we could do to support that elderly neighbour. But in that moment, that what if they become unwell is hypothetical, and that's when we need to try and let that worry go, and we'll talk about some techniques to help with that. So I hope that makes sense. So with the worry tree, you can follow it down the diagram here. So it's about noticing the worry, and this is a really important step because I imagine we've got lots of different worries that are going at the moment. So we really want to pinpoint what it is that's really worrying us. And getting that down onto paper can be really helpful as well, because often it can just take some of that intensity away when we get it out of our heads and onto paper. And then asking yourself that really important question. So can I do something about it right now? If the answer is no, that worry is hypothetical and we need to try and let it go, which we'll talk about in the next slide. If the answer is yes, then that's a practical worry and there is something we can do about it. And it talks you through how we can then problem solve that. So then it's about thinking what we can do, when we can do it, and putting a plan in place for what we can do with that practical worry. I think we'll find a lot of the worries that are coming up for us at the moment are those what if hypothetical worries. And sometimes just categorizing them as hypothetical, recognizing that they're hypothetical is just can be so helpful in itself, because it can remind you actually there's nothing I can do about that worry about right now. All this is doing is making me feel more anxious about the current situation, and that in itself can be enough to let it go. Is there anything you'd add to that, Becky? That was really wordy, but
no. I would just echo what Charlotte just said. The worry tree is probably one of the more simple tools that we use, but it is so effective because it asks that $1 million question that we don't typically ask ourselves: can I do something about it? And it really forces you to answer with either a yes or a no. And if it is a no, it gives us permission to not worry about something, because actually if it's out of my influence, if I can't do anything about it, I don't have to worry about it. And then that then comes back into looking at sort of self-care. Giving yourself permission to not worry about something is such a good self-care tool. So I definitely would encourage using this. Apologies, it's so small on the screen, but if you Google worry tree, you'll be able to find loads of copies of it.
Lots of different examples.
Okay, so we're just going to look a little bit at uncertainty. So there is a whole load of uncertainty around everything at the moment, because no one knows what's going to happen. No one knows what's around the corner. This has never happened sort of on this scale before. So no one knows how to predict what's going to happen day by day. And as it says there, we are creatures of habit as humans. We don't like change. And a lot of people, especially if you experience anxiety regularly anyway, find uncertainty very difficult to sit with. It's very uncomfortable. And it's understandable you then feel some level of anxiety, because it ties back into that role of the danger brain, the amygdala, that actually uncertainty is a threat, is something that could potentially cause us harm, so therefore it makes us feel anxious, because it is seen as that threat. So what we want to try and do is build up our tolerance to uncertainty, which we're all being forced to do at the moment, and it's not easy, and we are being forced just to sit with a whole host of anxiety and a whole host of uncertainty. But again, it's just recognizing that that is making you feel anxious, and just doing what you can to manage it with some of the techniques that we'll talk about in just a second. Okay. Anything you'd add to that, Charlotte? No. Okay, so do you want to talk through the breaking the cycle?
Yeah. So these are some techniques that can be used to try and let those worry. When we acknowledge there's nothing that we can do about them, what do we do with them? So for some of the worries, just acknowledging that they're hypothetical and there's nothing that we can do might be enough to kind of let those worries go. For some of them, they might keep coming back, especially if we are experiencing kind of anxiety, which a lot of us are at the moment. So these techniques can be really helpful to use to try and let those worries go. So I'm going to briefly talk you through them, but again, there's lots of information online about these kind of different techniques, which you can have a look at. Worry time. So worry time is a technique which we use with our patients that are experiencing anxiety. So this is about trying to feel a bit more in control of the worries that you have. So you can set aside a time each day that you essentially let yourself worry. So for example, if I were to say, okay, my time is 6 till 6:30, that's my worry time, where you sit down without distraction and you allow yourself to worry and to think through your worries. Outside of that time, what we want to do is actually go through the worry tree, acknowledge that it's hypothetical. So this is for those hypothetical worries. Write those worries down and say to ourselves, okay, I'm not going to worry about this now. I'm going to come back to it at worry time in my allotted slot. What this helps us to do is it helps us just to create a bit of distance from that worry, and it allows us to acknowledge, well, whilst I may not feel able to fully let go of this right now, I am going to postpone it to another time. And hopefully the more that we do that, the more we get used to postponing that to a different time, the more we're able to let that worry go in the moment. So that's a really helpful technique, which you can combine with the worry notepad. So the idea of the worry notepad is writing those worries down. So this can be at any time of the day that you're experiencing these worries. If you acknowledge that it's hypothetical and therefore you can't do anything about it right now, you write it on your worry notepad and you say you're going to come back to it during your allotted worry time. Worry notepad can be particularly helpful for at night. So a lot of people say to us that when they go to bed that they notice those worries that are coming in for them. And they just, as soon as your head hits the pillow, that's when those worries really start showing themselves. Sorry, I'm just getting distracted by my dog growling in the background, so apologies for that. So writing that worry down on your worry notepad, so you have a little notepad on the side of your bed, write that worry down and say, okay, it's there, I'm not going to forget about it, I'll come back to it during my worry time. And that can help get that worry out of your head onto a piece of paper and give you the reassurance that you're going to come back to it, because that can often be something that gets in the way of us letting our worry go. But giving you that reassurance that you're going to come back to it during your worry time, but it'll help you let go of that worry in the moment. Visualization can be really helpful for some people, especially if people are visual. So actually using visualization as a way of letting worries go. So one visualization technique we use with some of our patients that we work with is imagine a kind of hot air balloon, and all of your worries, you're popping them into the basket of the hot air balloon and then you're watching it drift off. So it's just visualizing those worries, seeing them for what they are. They are worries that are fueling your anxiety cycle further, placing them into that balloon and just watching them drift away. Often we get into the trap of trying to push those worries away, trying to suppress them, if we do that, what we can notice is they just keep coming back, and they keep coming back with stronger intensity. It's a very subtle difference, but what we want to try and do is accept that they're worries, accept that there are anxiety manifesting in these thoughts, acknowledge that they're there, but let them pass. Another visualization technique that can be helpful is imagining that you're on a platform at a train station. So you're waiting for your train, and whilst you're waiting for your train, another train comes in. That isn't your train, so you don't need to get on it. So what you would do is you'd let that train pass. You can't deny that that train is there, because it is, you can see it, but you let that train pass, and then your train will come into the station. It's the same with our worries. We can't deny that they're there. We can't deny that they exist. What we can do is accept them, acknowledge them for what they are, and let them pass. So that can be a really helpful one. Singing. This can sound really strange, but what we're doing with singing is actually taking the sting out of the worry. When we're experiencing anxiety and we're having all of these different worries that are going on in our head, what can help to do to kind of let those worries go is just to take their sting out of them. And by singing it or repeating them again and again, or by saying these worries in a funny voice, we're not minimizing them, because we understand that these worries can come from a very real place. Yeah, it's not to say that these worries aren't very real to you, but what we're saying is it's not helpful to keep going over and over them, because they can make us feel worse. So by singing them, repeating them, or saying them in a funny voice, it's just helping us to acknowledge them for what they are. They are a worry that's triggering our anxiety, and it helps us to see it in a different way and to give us a bit of a perspective. So those can be really helpful techniques to help take some of that emotion away from the worries and help you to see them as worries, and therefore to let them go. So there's a few other things on here. So progressive muscle relaxation. So again, we won't go into this in today's session, but if you kind of type this into Google or whatever you use to surf the internet, progressive muscle relaxation is a really nice technique to let some of those worries go, because it helps us to focus in on our bodies. It's a very relaxing technique which can help us to feel more relaxed and calm down those physical symptoms that we can experience when we're feeling anxious. Grounding and attention control, again, you can kind of look these techniques up, but with this, what can often be helpful is the 5, 4, 3, 2, 1 technique. So I always say it in the wrong order, so forgive me if I do, it doesn't really matter. But you can say, what are 5 things that I can see? And try and spot 5 things that you can see around the room and really pay attention to them. What are 4 things that I can hear? So again, tapping into that sense. What is it that I can hear around me? So I can, for example, currently hear my dog growling, but what it is that you can hear around in the room. 3 things I can feel. So what can you feel around you? 2 things you can smell. 1 thing that you can taste. So that's a really nice grounding technique, because what that helps you to do is bring you back to the present moment. So what these worries will often do is they'll try and pull you into the future, because you're thinking of all those what ifs, and often you're thinking of all the worst case scenarios, and you can see how that can make you feel really anxious. And again, we're not saying that those worries don't come from a real place, because we know they do. We are in an uncertain time. We may have had past experiences that trigger those worries and make them feel very real. We're not questioning that at all. What we are saying is putting your focus on those worries and going over and over them just isn't helpful. It's understandable, but it's not helpful for your mental well-being. What can be helpful is to ground yourself in the present moment and take it day by day. And that's what the 5-4-3 technique or other grounding and attention control techniques, which you can find can be really helpful for. So meditations, I know, for example, there's Headspace, can be really helpful for this, and they offer 10 free sessions if you download the Headspace app onto your phone. There's lots of different apps and lots of different things out there that you can find to help you feel more in the present moment. Anything you'd add to that, Becky?
Not really. I just really encourage everyone who is watching this just to research these techniques and just find what works for you. And it might be that you try one and it doesn't work for you, so just try another one. They're really good to be used sort of alongside each other, use them in conjunction with one another, and it's just finding what works for you. And if you find something that works for you, roll with it.
Yeah,
I think that's probably the only encouragement really, is just find what works for you and go with it. But there are loads of resources online that you can use for all of these, so do just a little bit of research and you'll be able to find something that hopefully will help you.
And also just being being really strict with that question, is there anything that I can do right now? Because often when we're feeling anxious, we'll want these problems to be practical, because if they're practical, we can do something about them. So our mind can be really creative in thinking, but I could do this, I could do that, I could prepare this, and thinking about the ABCD plan of what might happen and how you would resolve it. And that's your kind of anxious brain trying to draw you in. So it's really about being strict with yourself. Is there anything that I can do right now? And if the answer is no, then using these techniques to try and let that worry drop, because although that can feel really difficult, it's what's most helpful to help break out of that cycle.
Yeah, and also just remembering that unfortunately none of these techniques are overnight fixes. They are things that do take a lot of practice, a lot of regular use, a lot of repetition, and equally, we don't know how long the situation with the COVID pandemic is going to go on for, so we can't say how long you're going to have these worries for. But if you get into the habit of using some of these techniques, it will hopefully take off some of the edge or some of those worries that we just don't really need at the moment, because we've got so much else that we're managing. Okay, so sort of just following on from the worry tree then, so looking at things that we can and can't control. This is the circle of influence, which is another really helpful tool, and it's just thinking about the degree to which we have control, influence over something. Because typically when we're feeling really anxious, we try desperately to control everything, no matter whether we do or don't actually have influence over it, because we like that feeling of being in control. And at the moment, there's so many things that are completely outside of our control or outside of our influence. That's just going to be feeding into that anxiety, because it's that uncertainty that we just don't like. As humans, we do not like uncertainty. We don't tend to tolerate it very well, so we try desperately to get control over things. So the circle of influence is just, again, like the worry tree, giving you permission to not worry about things that are outside of your control. So the example that we've just got here is looking at what actually can you control, and it's only a very small degree of things that you do have full influence over. So these all fall in with you. So actually the things that we have full control over are what we do. So what we do with our worries, how we're reacting, how we're responding in this very difficult situation. There's a much wider array of things that fall outside of our area of control. So we can't control other people. There's a lot of frustration at the moment, sort of on the news, on social media, about people who aren't abiding by the social distancing rules. It's as frustrating as that is, we can't control other people. We can only control what we're doing in this moment, making sure that we're following the guidelines as we need to. We also can't control whether other people in our lives, whether it be our family, friends, colleagues, anyone, we can't control whether they become unwell. And that's really difficult, because obviously we don't want these people to become unwell, but it's not something that we can control. Well, again, the thing that we can control is how we're looking after ourselves to make sure that we're following the distancing guidelines, that we're making sure that we're kind of being responsible for our own health at the moment. That's within our control. Other people are outside of our control. So there's a lot of things on here that are outside of our control, and that's really difficult. But again, it comes back to that idea of acceptance that we spoke about at the beginning. The quicker and the earlier we can accept that these things are outside of our control, the easier it is for us to focus on the things that are within our control, because they're the things that we have an influence over, and they're the things that we can control, rather than fighting against trying to control things that actually are outside of our control. That's just going to be feeding into that feeling of distress at the moment. So it's not easy, but this is a really helpful tool, the circle of control. Just to bear in mind when you notice you might be fighting against things that actually you don't have any control over. Anything you'd add to that, Charlotte? No? Okay. So just really quickly going through some relaxation. I'm not going to talk around this too much because Charlotte has already spoken about this when she spoke through the progressive muscle relaxation and to some degree the grounding exercises in the previous slide. But relaxation is such a good way of soothing yourself and grounding yourself during difficult times. There are loads of tutorials that you can follow online. YouTube have loads. There are loads of apps that you can download. So Charlotte just mentioned Headspace, which is a really good one. Calm is another really good one that I recommend to a lot of people. There are loads. But just even practicing a few minutes each day of relaxation and making it a regular thing that you do can be so beneficial, because what that does is it calms that amygdala, that danger brain down, and just tells us that we're safe and that we're okay. So it's just going to calm everything down. And it's most beneficial when you practice it regularly. So I always encourage people to spend sort of half an hour each day doing some relaxation, or break it down, do some when you first wake up and some just before you go to bed. It's going to be really helpful the more you practice it. And again, there's no right or way wrong of doing this. It's just finding the technique that works for you. So just do your own research, find what works for you, and it can be really beneficial. Anything you'd add about relaxation, Charlotte?
Oh, that's perfect. Yeah.
Oh, skip forward.
So this is just a grounding exercise that we suggest to some of our patients to help with grounding and relaxation. So it talks about kind of sitting or lying in a comfortable position, taking in 3 slow breaths, focusing your full attention on each breath in and each breath out. So that can be a really helpful grounding technique wherever you are, is to just redirect your attention back to your breath, because that can really help take ourselves out of our heads, out of what we're thinking about, the thoughts that we're having, and just reconnecting ourselves back to our bodies. And then it's all about, again, trying to reconnect yourself to where you are in that present moment. So feeling the chair or the ground underneath you, and the weight of your body pressing down, noticing the pressure of your chair or the ground against your body. So really tapping into that sense of feeling where you are in that moment, and feeling the contact between your head, your body and your legs. Because starting from your head and working your way down and noticing how each part of your body feels. So again, this can be a really helpful kind of grounding exercise, just to tap back into our physical kind of bodies and the way that we are, and tapping into our breath, to be in the here and now. So this can be really helpful when we're experiencing all of those worries going around in our heads and anxiety is drawing us into the future, actually happen to ground ourselves. So often this is used in lots of different ways, so in yoga, meditation, but it can just be really helpful to ground ourselves in the present moment. And again, if you have a look online for grounding exercise, and there's lots of different ones out there, so it's just about finding what's right for you.
Yeah, I would definitely encourage people to follow some sort of app or some sort of tutorial about grounding or relaxation, just because then you don't have to always be thinking about what you're supposed to be doing next. So it's just a lot easier if you have someone else talking you through it.
Yeah.
Okay.
That's
all right, sorry, I was jumping in.
No. So staying connected, so this is another thing that's really important at the moment. So we are social beings, and it's really important to stay connected for our well-being. So right now it may be that you're separated from family, friends, colleagues, and it's just about trying to be as creative as possible with this. So scheduling in time for phone calls, or even if it's text messages, whatever it is that gives you that sense of connection to other people, can be really important at the moment. And if we're feeling low or feeling really anxious, we might feel as though we want to withdraw or avoid that contact. So it's just about making that a priority for if you are feeling that way, because staying connected is really important to our well-being. So thinking of ways that you can do this is really important. Yeah.
Apologies, technical error. And then just sort of summing up what, sorry Charlotte, just summing up what we've already said about self-care. You know, there is nothing, absolutely nothing that is more crucial at the moment than looking after ourselves as the priority, because as we have said multiple times throughout this little video today, if you're not looking after yourself, you cannot be expected to look after everyone else or manage all the other jobs that you have to do at the moment. So we have to be putting ourselves first, and it is not selfish. So this isn't just a case of looking after your physical health, but it's also, you know, prioritizing those enjoyable activities and those pleasurable activities that we spoke about earlier. And the three main areas that we really need to make sure we're looking after are kind of our diet, exercise, sleep, going right back to the basics, and making sure that we have those really well looked after in terms of a routine. So everything else is just so much easier, because if we're not, you know, eating properly, if we're not looking after our bodies, if we're not sleeping well, it's really difficult if those basics aren't in place. So we need to get the fundamentals right, so everything else that we build on top is just going to be a lot easier for us to manage. Anything you'd add to that, Charlotte? No? Okay. And then just around, you know, we've spoken about self-compassion a few times today, but just remembering that, again, you're doing the best that you can do at the moment. So it's very important to recognize when we are being quite self-critical. Typically as humans, we are our own worst enemies, but if we can engage with that, it's then much easier to step away from it. So think about sort of how you talk to yourself when things aren't going so well, or when you feel like you might have done something wrong or you could have done something better. We tend to treat ourselves really quite harshly, and we have this kind of inner critic that just criticizes everything that we do, and nothing we do is good enough. But if we can recognize that, if we can understand that, then it's much easier to step away from it. So what can be really helpful, I think Charlotte mentioned it earlier, is if you were talking to a friend and they said about themselves some of the negative thoughts you've had about yourself, what would you say to them? Would you tell them that those thoughts were accurate? Would you tell them, yeah, you are a failure, yeah, you're not doing good enough? The chances are you wouldn't. The chances are you would say, let's look at this in a different way. You know, is there a kinder way that we could look at this situation? So it's just about sort of recognizing those negative thoughts when they pop up for us and learning how to challenge them, just so we're being a little bit kinder to ourselves. So we've just got the example at the bottom there. So we might be having a thought that actually I'm useless, I don't know how to do this. If we can flip that to, this is a new situation where everyone is having to learn new skills, I will get this. It's just a lot kinder for ourselves, and it's taking off that pressure that actually we're failing in some way, and that we have to be perfect. It's just trying to get that little bit more of a balance. Anything you would add to that, Charlotte? No? Okay. Okay, so we are sort of coming towards the end. So just looking at some sort of key tips, summing everything up. I think the most important thing for us all to remember, no matter who we are or where we are at the moment, this is going to end eventually. We obviously don't know when it'll end. We don't know how long it's going to go on for, but it will end. And the human race are quite a resilient bunch. So, you know, we will get through this. Try to stick with a routine as much as you possibly can. So as Charlotte mentioned earlier, getting out of bed at a similar time, having a sort of a similar bedtime each night is so important. Keeping meal times regular, you know, as much as we possibly can, get that routine going just to try and tackle that lethargy spiral. Stay connected with other people. We have to be quite creative at the moment, so because we're not able just to pop around for a cup of tea like we might usually. But if we keep in touch with people, be it sort of by text message, phone call, you know, all of these new sort of video chat sites that have now popped up, it's going to be really important to keep that sort of social aspect of our lives going. And staying busy, so much like that routine, keeping yourself occupied so we don't sort of have too much time where we're sitting around doing not very much, because that's when that lethargy spiral starts creeping in, that's when those worries start creeping in. But it's really important to remember to get that balance. So we're not only staying busy with work or chores or those routine things, we are also getting those pleasurable activities in as much as we can as well. And then I guess the last message would just be give yourself a break and keep yourself as safe as you can. You're doing the best that you can do. We all are. There is no handbook or there is no guidebook on how we're supposed to be managing at the moment. Just do your best, and your best is absolutely fine. Okay. Anything you'd add to that, Charlotte?
No, not at all. That's, yeah, everything. Just do what you can. Yeah.
We've put on any questions, but obviously we have just I have just realised that this is a pre-recorded thing. So
we'll
do you have any questions, Charlotte?
No.
No. We'll gloss over that slide.
Yeah.
Okay, and then just sorry, carry on.
Yeah,
carry
this
on.
is just the service criteria. So as we mentioned at the start, if you do feel that you need further support for your mental health, then you can refer to our service. It can be a GP referral or self-referral, so you don't need a GP to refer you. You can refer yourself to the service online, or I think we've got the number in the next slide. You must be 16 years or older to come into our service and registered with a GP in Portsmouth, and not be receiving support from any other mental health service. And also, just to remind you, we're not an emergency service, so you can't offer immediate support. So if you did need that immediate support, we'd suggest you go to your GP or call 111. And then I think on the next slide, yeah, these are how you can refer. So you don't need a GP referral, although you can be referred by a GP. If you want to be, you can access us online on www.talkingchange.nhs.uk, and you can self-refer yourself on there. Or you can refer on the phone by calling 0300 123 3934. So that's how you can access more support with us if you need to. But I suppose the purpose of today was just to give you all of these ideas of how some techniques you can use if you feel they would be helpful, but to send that main message of just getting through the day at the moment, feeling as you're feeling and not putting too much pressure on yourself is really important as well. And if you did feel you need more support with your mental health, then please do refer yourself to the service.
Yeah. And just on that note, if anyone is does end up watching this that isn't registered with the Portsmouth GP, or you are elsewhere in the country right now, there are IAP services all over the country. So just Google where your local IAP service is. That's IAPT, so improving access to psychological therapy, or speak to your GP and he'll be able to advise you who your local service is. They all run very similar, so you should be able to get some support. And just sort of shameless plug for Talking Change as well. We are also on Facebook and some other social media, including Twitter and Instagram. So if you want to sort of check out some of the things we put on there, where we sort of send out some helpful tips and tricks all the time about various different issues, please do feel free to have a look at that. So I believe that's the end of the presentation that we have today. So thank you so much. If you have stuck with us, sort of me and Charlotte have just sort of bumbled our way through this, but hopefully there are a few things in there that you do find helpful. They're just all a few tips and tricks that we know to be helpful. So we just encourage you to give it a go. And I guess because I've already said it 100 times during this, just remember you are doing the best that you can do. And that's all that anyone can ask at the moment.
Yeah, definitely. Thank you.
Thank you so much for watching.
Bye.
Bye.